Welcome to This Week in Missouri Politics. We're not in the normal studio. We are in Kansas City, out here on the steps of City Hall with Mayor Quinton Lucas. Mayor, thank you for making the time.
Hey, it's good to be with you.
So this particular place we're at right now, every time I've ever been here, even at like 11 o'clock at night, there's people buzzing around and activity in downtown Kansas City. The streets are quiet. You can actually hear the fountains. What's the status of Kansas City today?
You know, it's very different than I've seen it my entire life. We are still under now a modified stay-at-home order. We started seeing some businesses open up yesterday in Kansas City. We'll have more opening up on the 15th of May.
What started opening up?
So the things that started opening up were once classified, I know there's a lot of debate about it, but as the non-essential businesses that didn't have a lot of customer traffic.
Sure.
So throughout the whole crisis, hospitals, those sorts of things have been open. Yesterday, smaller stores could open, particularly if they weren't getting that much traffic in.
Yeah.
Also barbershop salons with a lot of protections. We're requiring those who are providing services to wear masks and gloves. It's optional for people receiving services to wear masks and gloves, but we recommend that. So if you go and get your nails done or something like that, to do that. And then next week on the 15th, we'll probably add restaurants, a few others, and pretty much be at a full opening. Now, still with percentage capacity requirements, that sort of thing, but we wanted to make sure we're getting back to business in Kansas City. Not as fast as the rest of the state did it, but still, I think, in a good moderate path.
Talk about that. I mean, there's a lot of folks in this. I've never seen the Missouri divide more than right now. And you know, people want to say that's because of previous biases, but really, if you're in Berry County, there is not that many sick people. You're not as big a danger than you are in Kansas City. Talk about why you've had to do things a little differently here in Kansas City than the rest of the state.
You know, we continue to have issues with outbreaks. You know, we're not quite as impacted as St. Louis City and County, and God bless them. I know that folks over there are working hard, but we continue to have a level of density here. A lot of people traverse this area. You know, the airport for this region, really the airport not just for Western Missouri, but for almost the entire state of Kansas, except Wichita, is the one here in Kansas City, Missouri. And so we have a lot of folks coming through. We feel like it's important to protect them. And the other thing that I think we've seen is a lot of our public is really interested in these levels of protections. I hear from people each day, and it's kind of interesting. The governor and I had a chat about this where, you know, darned if you do, darned if you don't, because I've got people calling me and saying, Lucas, this place needs to be shut down until they have a vaccine. Then on the other side, you're like, you moron, you should have opened it up, months ago. And so we're trying to hit a good path here in Kansas City, and I think we have so far.
I mean, people talk about testing. I hear everybody talk about testing, and I'm from the Boot Heel. I'm a simple hillbilly from a part of the state that loves Donald Trump. They see no wrong in it, but the fact is, whether you want to blame whoever, there's really not going to be significant testing that you might want for several months even.
No, and I told the Kansas City Star that the other day because they were saying, well, aren't you going to hold everything off until there's adequate testing? And I said, we're not going to be there.
When is that? Yeah.
I mean, we're just not going to be there. So what a big part of my opening process has been is how do we live with this? How do we actually go through the steps to kind of get back to life as normal as it can be, knowing that, folks are going to have to go to the dentist again. People are going to have to make money again. And again, I'm not saying that to sacrifice human life. I mean, because I've probably been one of the more small C conservative people in terms of reopening, certainly in this region. And so we will continue to push that as time goes on.
Well, tell me though, when you do start this reopening, you've done some contact tracing that's been very popular as far as being talked about as a model. Walk through what that actually means to a regular person that's going to the barbershop today.
What it means now is very simply that if you go to a barbershop, and there's been some controversy, it's a voluntary thing where if, let's say, a barbershop keeps appointments, and we're encouraging them in Kansas City to keep appointments. If we learn of an outbreak, the goal is that our health department would tell the barbershop, you should let a lot of people know. Let Scott know that last Saturday when he came in, there was a barber who had been exposed to COVID or came down. That allows us to call people and really try to stop it in its tracks. I mean, that's the way that public health happens. An example people might know a little better is if there's a measles outbreak at an elementary school, for example. We don't close every elementary school in the state. What do? We usually find out what classroom was impacted. You tell the parents who were in that classroom or their kids were in that classroom, go test the young persons, and then you kind of try to contain it from there. So it's not spreading randomly. That's an important step that I think Kansas City's taken, been on the forefront of. We're hiring more people for that, and that's how we're going to stop this long term. What we can't do is just let the community spread kind of grow out of proportion like you're seeing in some of these meatpacking plants.
It's interesting, certain parts of the state look at the government differently. In Kansas City, people do not have a natural aversion to government. It's their neighbors, they live closer together. You can do contact tracing much easier in Kansas City. If you tried to call some of my family in Butler County and the government wanted to know where you were, they'd be like, none of your business, I'm not telling you.
Right.
But in Kansas City, those things are embraced more, and it's a diverse state. And I did like what the governor did when he kind of turned some of these decisions over to you, because you probably know better and maybe could make a better decision than folks in Pemiscot County could for them.
You know, one of the things that I found very interesting about this whole cycle is every time you say something different than the governor, then I'll read the paper or the news, and they'll say, Parson said this, Lucas says this, and all that. He has worked with us tremendously well in a state, and you've been covering Missouri politics for years, where often there's that battle, right? There's that preemption question, there's all of that. The governor, from the beginning of this crisis, has said, you know what, I'm going to let Quinton Lucas, Lyda Cruz, and Sam Page do what they need to do to keep their city safe. Brian Treese, Ken McClure, and I've appreciated that. And I think they've continued to provide us that help. And whether it be on health issues, whether it be on funding issues, that's been important for us. Governor Parson has been great with that. Treasurer Scott Fitzpatrick has been very helpful with that. And I've really appreciated, at least at the executive level, the relationship we've had with our leadership in Jeff City.
And looking, you know, this isn't something he just started. It wasn't like he started meeting with you guys, really, when you got elected. It was by the time he was having these meetings went on before COVID-19. I thought he had a lot more credibility with people because he has reached out. You know right where the governor's office is in Jeff City because you've been there a bunch.
Right. You know, it's interesting because somebody was telling me this is different than they'd experienced with any governor, so Democrats and Republicans. And, you know, it is something that, say what you will about them, maybe you're a different political side, anything of that sort. It's been good for Missourians. It's been good for somebody who lives in the inner city of Kansas City, Missouri. It's been good for somebody who lives in Butler County, that we have somebody that recognizes that he's the governor of our entire state. And I've appreciated that, even if we've had disagreement on substantive issues, and we will, you know, we'll probably we will support different presidential candidates. But at the same time, I think it's been good for both of us.
Talk about the budget. Your budget has to be, from households to businesses to cities, has to be decimated. What is the status of Kansas City's funds?
So, you know, right now, we are fortunate in one way that a lot of cities aren't, although St. Louis City is. We have an earnings tax. Now, of course, those will be down. We are expecting significant budget impact. We already have an estimate of about a $30 million drop here in the first months of our budget year, which started May 1. That's going to be huge. We're going to be hit even more. And for that reason, our money that comes from the CARES Act coming through Jefferson City to our counties is going to be vital to making sure we can pay for people like the police officers you're seeing, our paramedics, our firefighters, et cetera, the health testing that we need. So, you know, we're in a tough space. I think there are some who may be tougher, particularly if you're just relying on sales taxes, because those will be annihilated. Ours will be too. But, you know, we're going to find a way to make it through it. We're looking at estimates back from the last financial crisis. Most indications is that this may be worse. And, you know, we found a way. We'll find a way again. There's
some discussion in rural Missouri where there's not a lot of COVID cases. Those from the CARES Act, those communities really can't spend that money. There's restrictions, has to be COVID related. You really don't have the ability to access those funds. Places like Kansas City, you could probably use that money. There's some work being done to maybe shift it where you can, so at least Missouri can, everybody that fits the criteria in the state can have access to it.
That's absolutely right. I mean, we're trying to make sure that we can actually expend our resources, not just for Kansas Cityans, but for everyone. You know, if you get sick a few counties away from us here in western Missouri, often if it gets serious enough, you'll end up at Charlie Shields Hospital, or you'll be somewhere here in Kansas City. And we recognize that, and we recognize that we really should be a resource for the entire state. I know earlier in the process, Randall Williams had mentioned that, you know, we were kind of doing some enhanced testing in connection with the University of Missouri-Columbia and Washington University, right? We have facilities here in Kansas City to help with that too. We don't see that as opportunities just for Como, St. Louis, and Kansas City. We see it as opportunities for everybody in this region, and we'll continue to do that. And I hope that ultimately, as we work through funding, and I know there are a lot of chats to be had, but everybody recognizes, you know, it's good for all of us to make sure we're supporting that expenditure, even if it is in Kansas City or St. Louis or in Columbia.
We see someone in Adair County, they would prefer to spend that money in Adair County, but if they can't, I think they'd rather spend it in Kansas City as Washington.
Sending it right back, you know? I mean, that's kind of, I talk to our delegation often, and actually we've had some great conversations with Senator Hawley lately. And, you know, we talked.
That's an interesting relationship. Some people were surprised by that. Tell me how that relationship started.
You know, it is interesting. Well, I mean, one thing is we're actually not that far apart in age and professional background, so that might help a little. But, you know, the darndest thing is, and, you know, our starting point is always kind of different. It comes from a different perspective. But frankly, I have appreciated how he's addressed some issues in a clear way. I think he's recognized, and I've recognized, that there are some problems that everybody wants to address in the same way. If you have an issue providing health care to poor folks in the inner city, you're going to have an issue providing health care to poor folks in the country. If you have issues making sure that we're getting our school children educated somewhere in the city, then it may apply elsewhere.
Kansas City mayors have historically done very well being friends with Kit Bond, a Republican.
You know,
it is a great deal.
It is a tradition, and actually, I will give away a little too much, and it's going to be used against me, I'm sure, someday. Kit Bond was one of my first votes because I think I've always recognized that, you know, we got to look out for what's best for our state and for our community. And so I've thought building a good relationship is important for us. I say all this doesn't mean I won't be endorsing Donald Trump tomorrow, but at the same time, you know, there's no reason we can't all get along.
Produce for Kansas City.
Right.
Talk about Wayfair. The legislature's in session. It seems to be a clear inequity. It's just how do they solve it, and are they able to come to a compromise, right? You know,
yeah, exactly. I mean, I think they will be able to come to a compromise. I mean, it makes sense that right now a company, a city in Missouri, right, has to pay all of this money, all of that, and paying sales taxes, but somebody who's selling widgets from China and puts them on Amazon doesn't have to pay anything, right? It's anti-competitive. So why is it that the corner store in Kansas City or the corner store in Cape Girardeau, right, has to pay these fees and other people don't? Particularly, we're seeing it right now in this crisis, because it's unfair for our local businesses that are saying, hey, our shop may be open, come on in, but folks are ordering everything off online and that sort of thing, and then we're not getting that money back to our cities. We're making unfairness for Missouri businesses.
Last question is, how will folks in Kansas City and the rest of the state know that things are starting to get back to normal?
You know, I think a few things. One, the rate of new infections stabilizing and going down eventually. And you know, one of the shames was we were really on that path in Kansas City for about 4 straight weeks. We've had a spike because some of those folks who work at the meat packing plant in St. Joseph live here in Kansas City, a decent number of them. But I think that as we see the reopening, that's why Kansas City's is phased. I'm sure St. Louis will be that way. I know Jackson, Clay, and Platte will be the same way as well. We're trying to make sure that before we go to the next phase, we see that stabilizing in cases, right? I read an editorial today in the Chicago Tribune. I think it's a fair critique that over in Illinois, they were saying it seems like their governor is kind of moving what is, your in-run measurement. I'm trying to make sure people know that the things I've always cared about are new infections, testing, tracing, and hospitalizations. We're good on hospitalizations. We need to enhance testing and tracing, but really that thing is, let's see if we can stabilize, almost decline those new infections. We'll be in a good place.
Mr. Mayor, thank you so much for making the time. I really appreciate it.
Thank you for what you do.
We'll be right back with our opinion maker panel, a socially distanced opinion maker panel, former Senator Charlie Shields and former Senator Victor Callahan, after this.
Mike Parson served in law enforcement for 22 years. A former sheriff, Parson is tough on crime. Governor Parson is standing up for victims, investing in better mental health services, and cracking down on violent crime and drugs. Governor Parson's anti-crime initiatives have led to the arrests of hundreds of violent criminals and gang members. A former sheriff, a conservative, tough on crime governor. Mike Parson is making Missouri families safer.
All across Missouri, our new car and truck dealers are building strong local economies. When you buy a car or truck in Missouri, you're helping to support over 20,000 Missouri families who rely on the auto industry for good-paying local jobs. You're also helping fund our communities, schools, first responders, and our roads, because dealers generate millions of dollars in tax revenue. Missouri's automobile dealers have been the foundation of our communities for generations, and for generations to come. The Missouri Automobile Dealers Association.
Your energy needs are changing. That's why at Ameren, Missouri, we're not waiting on the future. We're building it with the Smart Energy Plan, advancing thousands of projects across the state, helping reduce emissions through cleaner energy sources, boost reliability with self-healing equipment, and better withstand storms with new composite poles. Moving Missouri forward and bringing us all a little closer together. That's energy at work. Ameren, Missouri.
Welcome this week at Missouri Politics. From Kansas City, we are downtown on the steps of City Hall, joined by two Kansas City fixtures. Independence fixture, Victor Callahan, former state senator. Welcome back, sir.
Welcome.
And former state senator, former president of the Senate, and maybe even more interesting right now, the head of Truman Medical Center, Senator Charlie Shields. Welcome back.
Thanks, Scott. Great to be here.
Let me just start. Everybody has been concerned about flattening the curve, and the curve has been flattened for hospitals so they don't get overtaxed. Senator Shields, tell us what is the status right now of Truman and around the state? What are the status of Missouri hospitals?
So we're doing a lot of testing at all Missouri hospitals, and we've started to see, the positive rate go down, although it's starting to climb back up gradually. We have a lot of capacity right now, so should we see an additional surge as we begin to open up things in Missouri, so we feel like we're in pretty good shape. I think all the orders at the state and the local levels really bought us some time to get us to this position, and we feel pretty good about where we're at right now.
Senator Callahan, let's talk about the response at the federal level. You're from a part of the state that supports Donald Trump more than most any Republican. I'm from the Boot Hill where they love Donald Trump. There could be more testing. Everybody talked about testing. You're hearing people talk less about that now because they're just not available. Rate the federal response.
Well, I wouldn't rate it other than to just say that it involves all levels of government. A phenomenon like this and a crisis like this involves everybody working together. I think one area that the federal government could do is to coordinate all that better. Yeah. It doesn't necessarily say that there has to be a federal warehouse somewhere, but they should coordinate those efforts better and those resources and get the states and get the hospitals what they need. It's sort of frustrating for Americans, I think, to see that the United States of America doesn't have enough masks, doesn't have enough swabs, the greatest nation in the history of mankind. And so to the extent that the federal government accepts that challenge, coordinates those activities with states, works with problem areas, and also over time, as this pandemic continues and plays out, hopefully they're taking this opportunity for Jackson County, for Truman Medical Center, for all the hospitals that aren't overwhelmed, to prepare them as far as resources if there is another spike several months from now. We have no idea if that happens, but I don't want to in August read about hospitals here, fighting to get masks with every country on earth and every other state in the United States.
So Shields, you're at the forefront of this. We talk about testing. It looks like testing that people would dream about is not going to be available anytime soon.
Well, so we have a lot of testing available in that 24-hour turnaround time. So we've done well over 4,000 tests at Truman Medical Centers, so we can do that. The part that's missing right now is the rapid test, the point of care test, where you can get results back in 15 minutes. So we're still waiting on that. That's the Abbott test that everybody's talking about. I think once you get that, I think that really adds to our testing capacity and also the ability to gather information, determine who's positive, and then do your contact tracing. I think that's a key.
Everybody's heard about first responders and masks and things. Are folks in Kansas City, are the healthcare professionals here able to have access to those things?
So there's still a shortage of PPE, and the gold standard, which is the 3M N95 mask, we're working on that. Now we have strategies around that where we can reuse them. We actually use ultraviolet light to disinfect those masks, so we get multiple uses out of that. That's helped. But moving forward, that's still a challenge, although I will say the supply chain is better today than it was 2 months ago, so we're making progress on that. I think all the orders, when I talked earlier about buying time, that got us to testing, that got us to a more consistent supply chain on PPE, and I think that's why we're in a better position today than we were 2 months ago.
So you worked with Dan Clemens and Rita Days when you were in the Senate.
Yep.
You've seen the very diverse parts of the state and how people look at it. I thought Governor Parson has had a pretty good, he leveled the playing field for this pretty well by having relationships with mayors like Quinton Lucas beforehand. I thought his regional diverse response seemed to make some sense. What has been the state's response so far?
So absolutely give Governor Parson credit for understanding that this is a very diverse state and that it's not the same in the Boot Hill as it is in Kansas City versus St. Louis. All you have to do is look at the modeling that's out there right now for the progression of the disease state. It's vastly different in different parts of the state. So I think what Governor Parson did was understand that and then rely on local government either at the county level or at the municipal level to make decisions that seemed appropriate, providing the best advice from the Department of Health and Senior Services and others that are monitoring this. So I think it's the exact right response.
Vic, let's talk about the local response. Quinn Luke's been very active here. He tried some innovative things. I think most folks in rural Missouri, Tim Brinker in Washington County stood out. It looks to me like that diversity is really shown here. Give a folks in the local response here in Jackson County.
Well, I think in March, and it's easy to look at these crises of, well, you should have done this back in March, you shouldn't have done this. Really governments, state governments, county governments, city governments, the city of Kansas City, all they had was a broad draconian tool in the toolbox, and that was stay-home orders. Because they didn't really have the testing or the data to determine how to do a more precise approach to it. They didn't even know necessarily where hot spots were and where they weren't.
Yeah.
So it's easy to look back and say, well, you know, on the stay-home orders, that was all that was available to the states and communities where they had hot spots. I don't think anybody who's against a stay-at-home order would say it was a mistake for the city of New York, for example, to do a stay-home order. That was clearly a huge outbreak that required an extraordinary government response.
Charlie, you in your Senate district, now you're on the front end. You actually get to see in real time these healthcare reports, and you understand the severity of this pandemic. You also used to represent some folks. If I had to guess, you have a few old constituents who probably did not like a stay-at-home order. What would you say to somebody that maybe lives in a part of the state that did not see a pandemic hit their county and maybe doesn't understand what all the fuss is about?
Well, first thing I would say is maybe they didn't see a pandemic in their county because of the stay-at-home order. But it was so necessary to give us the ability to get ramped up on testing, to understand what was going on, and allow us the ability to come back, which we're doing right now. So I realize it's tough on people, but you know, it saved lives, and it will save lives moving forward as we're now more prepared to deal with the pandemic.
Victor Callahan, let's talk a little politics right now. Legislators are coming back tomorrow for their final week of session. They've got the budget done. Now it's an interesting thing. I mean, I think a lot of people would have felt good if they would have legislated up until the budget was done and then maybe didn't the last week, weren't in the Capitol. They are going to be in the Capitol. I think one of the most interesting people would be John Rizzo, person that took your Senate seat. He's the minority leader now. He could kill a lot of things, but it would be heavy-handed. Very unique situation. If you were in the Senate right now, how would you handle the last week of session?
Well, hopefully there's a lot of bills that have added a lot of things that they become huge omnibus creatures. And the first thing would be to have the conference committees between the House and Senate break those back to the base bills. The other question everybody should be asking is that going forward, have they taken care of everything they need to for Governor Parson and state government going forward after they leave, as far as resources to hospitals, hopefully the budget and that. Statutorily, have they handled all those things? Because, you know, the reason you're in the middle of a crisis, so you have to deal with those things first. So before you leave or go home, make sure you've handled all that. Before you go to all these other bills that maybe aren't such a priority, make sure you've taken care of that. Back to your question of the Senate floor, if the conference committees don't, chop the bills down to their base and do away with a lot of, ideas that maybe were good in January, but now might be a hindrance in May, and later if they become law, that's really the function of the Senate floor that Charlie and I served on. The Senate has extraordinary power through the power of the filibuster, to stop that big bill from becoming law, forcing it back to conference and chopping that legislation. And again, this happens every session. I just think that given the circumstances that we're under, we don't necessarily have, maybe the same level of patience for, big bills and I certainly worry about state government going forward, that they don't have a lot of ideas that have been put upon them in the middle of what they really should be focused on, which is the crisis facing the state's economy, the crisis facing the state of Missouri.
Former Senator Shields, I mean, we are not in normal times. We are shooting this show on the steps of City Hall instead of in a TV studio. I've never even heard of a time that's been as unique as this. In the Senate, it's all about slowing things down, passing a few things. Essentially, if you're in the minority in the Senate, 6 weeks of session being gone was helpful.
Yep.
But how would you, if you were on the other side, you've been in that majority leader office, you've been in the president's office, how would you manage how to use that power, but maybe in a statesman-like way?
Well, I think, when you get down to the last week of session, the power really sits in the two floor leaders, Rob Vescovo and Caleb Rowden. So they're the ones calling the shots. And they're going to have to show a lot of restraint, particularly with members that are trying to get their pet bills across the line as bills cross over to either chamber. So they have to show a lot of restraint. They have to work closely with the conference committees to try to get those bills pared down.
You both served the last time the state saw a major financial crisis. It looked to me, from a person just observing state government, that you really probably had to let the governor have a wide berth because you really couldn't control every dime.
Yep.
How, you got a big federal stimulus that's came in just like before. Give some advice on what you went through with that big cutting in state government.
So the first thing you have to do from an appropriations standpoint, and I give certainly Senator Hageman and Cody Smith credit for this, you got to pass a budget that has excess capacity in it and give the governor the ability to do withholds and manage that. The next thing, you just have to realize you're probably coming back in a special session in the fall, dealing with a lot of budget issues and passing another supplemental budget early on in a special session, trying to give the most credit. It's a difficult time. We do not know the magnitude of the loss of revenue that the state budget will face. And it's going to require a lot of work by the governor, and hopefully, that ability to do that has been given to them by the House Budget Committee and the Senate Appropriations Committee.
Looks like the state's running out of money, we're running out of time, so who won the week?
I would just say that all the healthcare workers, all the people in grocery stores, all the people who have kept the economy going and kept the necessities of life for all of us, and really on the front line, the healthcare workers who are there dealing with this every day, and they won the week.
Former Senator Shields, who won the week?
I'm going to say the members of the General Assembly that consistently wear a mask. You don't wear a mask to protect yourself, you wear a mask to protect others, and they are showing incredible respect for their colleagues by continuing to consistently wear that mask when they're on the House floor.
Maybe it's time for a shout out for one in particular member of the General Assembly?
I would say Representative Brenda Shields, who is wearing her mask, and also in the next to last week of session.
Not everybody's going to be looking at her all the time now to make sure. You put her on the spot.
Absolutely.
I'm going to say the folks at the Missouri Hospital Association all over the state, there are people that aren't doing their normal surgeries, there are people that are even being laid off that work at these hospitals. They've really stepped up, and I personally am grateful for all the things they've done. Even if you don't have COVID, if you did, you need them. And we'll see you next week for our end of session show on This Week in Missouri Politics.
This Week in Missouri Politics, sponsored by the Missouri Association of Career Fire Protection Districts, Spire, and Sterling Bank.